Hi guys, this is Tracy's low budget film coming to you from my bathroom because it has the best lighting. So I'm hoping it's not too echoey. I thought I'd make this video this morning before my toddler gets up. So hopefully we get enough in time. But today I wanted to talk to you guys about stages of labor because we've been shorted on our time together and many of you will deliver, I think, before the quarantine is over. So, welcome. My visual aid. So let's talk first about early labor. That is 1 to 3 centimeters. 3 centimeters, that's the width of my 2 fingers, okay? So I know how tired you are and how ready you are not to be pregnant. And what's important is to not be too excited when contractions do start, because they're going to start pretty irregular and then they're going to kind of get their act together and start marching in a line. They're still going to be pretty far apart, and you're going to want to tell everybody, and I really encourage you not to. Keep labor for you and your partner or your support person, because you can add so much pressure to yourself by updating everyone else. So try to relax, and I know it's going to be hard. Try to sleep, because that is the end of your sleep after you have a baby. And drink lots and pee lots. So if you can sleep through your contractions, they're not serious enough to go anywhere, okay? And that's kind of the early stage of labor. Don't go to the hospital yet. You're going to be at the hospital long enough. Stay at home where you're comfortable, okay? That said, at any point, if you think your water broke, you need to go to the hospital. They can't test for that over the phone. You have to be seen in person, okay? The next kind of range is when your cervix starts to dilate from 4 to 7 centimeters. That's the size of a Ritz cracker to about the size of a soda can, okay? Your contractions get more intense, and when they are at least 5 minutes apart for 2 hours, that's the time to go to the hospital, okay? You got to keep trying to rest, but things are going to get more painful, and that's where your support person can kind of help you focus and practice breathing or other calming techniques that we'll talk about in a different video. It's still important to drink lots of water and pee a lot, okay? But at this stage, what's also super important is to start changing your position, okay? Because the birth canal is not a straight shot, and a baby is not a cylinder either. So they need help kind of rotating their way through. So walk, use a birthing ball, change positions in bed. Those are all really important, okay? If you think about it, a C-section, you're laying on your back with your arms out. Well, if you're in bed on your back, you're probably headed for a C-section. That's the phrase to remember. So sometimes during this stage of labor, that's when they want to give you a little bit of Pitocin too. Maybe you need a little extra gas to your uterus to keep those contractions forceful to where they need to be. And that's okay. Pitocin is not something to be afraid of. Sometimes you just need a little extra to keep your body going, okay? I'm going to switch sides on you. The next stage of labor is from 7 centimeters to 9 centimeters. So if 10 centimeters is a bagel, we'll say 9 centimeters is a small bagel. But this is called transition. And you're really focused inward on yourself right now. You might be shaking. You might be throwing up. You really need to change positions. It's going to be uncomfortable if you're not on an epidural or pain meds. Your support person needs to focus on reminding you that you can do it. During transition, it's really easy to have lots of self-doubt because it's scary. You've never been through transition before and you don't know what your body's doing. But you can do it, okay? And you'll see more bloody show during this part. And that bloody show just comes from your cervix dilating. Okay, it's nothing to be afraid of. Then, 10 centimeters. 10 centimeters, you're complete, you're ready to push. If you have an epidural and a baby is tolerating it well, they have you do something called labor down. And when you labor down, your uterus kind of does the pushing to get baby further down the birth canal instead of you with your legs up in the stirrups. Otherwise, at 10 centimeters, without pain meds, it's time to push, okay? Support person can coach you, but a lot of times once you hit 10 centimeters, there may be only one voice you hear in the room. You're so focused internally on what's going on there. For delivery, baby's crowning, even with an epidural, you may still feel the ring of fire, not ring of power, ring of fire. And that can be pretty intense. And the only answer is to push the baby out, okay? Once baby's out, they're placed on your chest for some skin-to-skin time. Doctor will numb you up if needed and repair any tears that happen. And then they give you Pitocin right after baby's born to help your uterus kind of clamp down and reduce bleeding, okay? Right after delivery, especially the first 2 hours, the nurses are going to be really attentive to your blood pressure as well as rubbing your uterus. And that can be pretty uncomfortable because your uterus just pushed out a baby. But it's important to reduce bleeding, okay? And then after the first 2 hours, they get you cleaned up, make sure you can walk, then you can start eating and drinking and starting pain meds. Typically they do Tylenol and Motrin, and then sometimes a narcotic if you need a little extra, okay? And that's what it is for the first 24 hours. You bonding with your baby, feeding them however you choose, pain meds, eating, drinking, sleeping, rest. So, also ice. Your lady parts just went through a big ordeal. So they'll provide you with ice and a numbing spray and Tux or witch hazel pads to help with your comfort. And we'll talk about that more in a postpartum care video coming later, okay? And then after you're discharged from the hospital, the focus becomes managing your pain if you're still having any, drinking lots of water, especially if you're breastfeeding, but also if you're not, eating good quality protein, letting your body heal, having good support systems so you get a break and get naps and get quality sleep so you can take care of your baby. Now you will be more tired than you have ever been in your life, but we want the sleep you get to be good sleep, okay? I also want to talk about baby blues. Baby blues comes from the avalanche of hormones you have after you have a baby, and it lasts up to 2 weeks. If it lasts longer than that, or you're having such bad anxiety, you don't want to take care of your baby, or you don't want to leave the house, that's time to be seen by a doctor. And at any time, if you feel like you're going to hurt yourself or your baby, it's time to get emergency care, okay? Most important, not most important, but very important, no sex, okay? We'll talk about it more in the postpartum care video, but you just had your baby, you're draining, there's a big wound in your uterus, there's no reason to put a dirty penis up in there, okay? If you choose to have sex, use birth control. Okay, you can get pregnant super fast after having a baby. Breastfeeding is not enough, and we'll have a whole birth control talk too. So I hope that kind of helps you guys feel a little more prepared for labor. I think we're going to make a few more videos about birth plans and what happens when labor doesn't go the way you expect it to. But that's kind of what to expect. Okay? Have a good one, you guys.